Welcome. Thanks for joining us today. Today, we are here with Diane Mariani, Program Manager at Rush University Medical Center in Chicago. And she's here today to talk to us about the Rush's Caring for Caregivers program. Diane, welcome.
Thank you, Rahat. So glad to be here today.
Of course, we're so happy that you were able to make it here in person. One of the perks of being is sharing a beautiful city together.
That's right.
Well, I was hoping that you could start off by telling us a little bit about this really important program that you have, the Caring for Caregivers program. Tell us a little bit about it.
Absolutely. So the Rush Caring for Caregivers program was initiated in 2019, and we received funding from the RRF Foundation for Aging. So they're a wonderful source of grant support and funding, and we decided to develop a program for family caregivers because family caregivers are really a critical part of critical support for the healthcare system, and they're really not recognized. They're kind of under-recognized, undervalued, and not really supported. So with that funding, we created a program to ensure that we were identifying caregivers. We were going to be hoping to understand them and what their needs were, and then providing support for them.
That's fantastic. And just for our listeners who might not be aware of the organization that you shared, RRF, could you just tell us what the organization stands for?
Well, they go by RRF Foundation for Aging, but it used to be named Retirement Research Fund. And so they really have a focus, and many focuses, but one of the focuses is on the health and well-being of older adults. Mm-hmm. So the program that we created actually does kind of focus on those caregivers that are caring for older adults.
And that makes perfect sense. And that's actually especially why you're here joining with us today to talk a little bit about how the important work that AHA does with the Age-Friendly Health Systems work, which is a program, as you well know, which is geared towards implementing the 4Ms framework, which is focused on providing enhanced care to older adults. And the 4Ms of that framework are what matters, and making sure we understand what matters to the older adult as well as their family. What matters, medication, and making sure they're on safe medications. If there's any need for high-risk medications, that's evaluated and appropriately given. Mentation, constantly making sure that the older adult is being cared for and is in a good state and mental state, making sure that their depression, dementia, delirium is all being monitored and tracked, as well as mobility, and making sure that those older adults are being able to be safely mobile and reducing the risk of falls. But of course, that doesn't necessarily mean that they just sit in the chair or they sit in the bed, and that's definitely not the ideal way to be safe. So can you tell us a little bit about what you do in your program that is specific to these older adults and how you pay close attention to that specific population?
Yes, definitely. So Rush is an age-friendly health system, happy to say. And so, we really recognize the importance of those 4Ms in the care of older adults. And with our caregiver program, we also focus on those 4Ms for the caregiver, which is really kind of special and unique. So the program really, as I mentioned, let me just say, first of all, that we really had a goal of kind of doing a systems change. And, that's a big undertaking when you're really trying to do a shift, almost a culture shift, and really getting just system-wide providers and others to really recognize the importance of these family caregivers in supporting older adults. And that, their health and well-being is just greatly connected to the health and well-being, right, of who they're caring for. So in our program, we identify caregivers, including putting them into the electronic health record, mm-hmm. so that when a provider goes to open a chart of an older adult, it's clearly identified if they have somebody that's providing care for them, correct. Contact information, et cetera. So this already tells the provider, the healthcare team, that here is somebody that is kind of working in direct contact with this older adult patient of theirs, and they're an important member of the healthcare team, right. And they see them clearly. And then we also do a host of assessments, mm-hmm. Evidence-based assessments on caregivers to really identify what their needs are. And this is really geared to their mental and emotional and physical health. And as they are providing care, and every caregiver is unique. So we do very individualized approach in everything we do, and we assess their needs, and then we develop a plan of support for them.
That sounds amazing. And I'm so happy to hear that the 4Ms are being applied to those caregivers, because just like you said, that group of individuals is so important to ensure that they're cared for so that they can provide appropriate care to their loved ones. Can you tell us a little bit about some of the outcomes that you've seen through this amazing program that you have?
Sure. Very excited about the outcomes that we're seeing. So for our caregivers, we're seeing significant reductions in depressive symptoms, anxiety symptoms, and caregiver burden. So now, some people may, well, what is caregiver burden? Well, we are really looking at, and we assess for this, it's really what is the impact on health and well-being. Financial is included in there. Just overall, what is the impact, and as they're providing that care in that caregiving role. And sometimes it's really just about helping them develop a plan for themselves and for the older adult. Sometimes it's bringing in additional resources and support. Sometimes it's really working through family dynamics. That's a big one for many. And I think you really can't get around knowing and working with family dynamics when you're working with caregivers and care recipients. And it's also advanced care planning. So what's the plan? What's the current plan? And what's the future plan? And we help them develop those plans.
That makes perfect sense. I heard us talk about the steps of the program, and that the first step is identifying this dyad. How does that work? Can you talk a little bit more about that?
Sure. It's really interesting, too, because, we use the term caregiver because we have to have some kind of a name to be able to know what we're talking about. But so many that are providing care don't resonate with that. It just doesn't connect with that term of caregiver.
That's so true. It's just something that they do, just like naturally.
Absolutely.
Mm-hmm.
We hear, I'm not a caregiver. I'm a son. I'm a daughter.
Right.
This is my wife, etc.
So obviously you're going to run the groceries. You're going to take dad to the doctor's appointment.
It's just what you do. You're a family member.
But
and
that means that you're a caregiver.
That's right. You're providing care. Right. So we're really aware of the language we're using and the approach that we take. Because if we just ask, are you a caregiver? We're going to get a lot of no's. And let me just mention, too, when I keep saying family caregiver, and that's really just to recognize that there's also direct care workforce out there that are providing paid caregiving, which is very important as well. Right. But when I say family, I really mean family, which could be family, friends, family of choice, neighbors, church members. It's really anyone who is providing some type of care and assistance. So we do really consider language, and we ask questions of like, are you providing care? And then we list some of those, as you did, shopping, and we mentioned because otherwise you're not thinking about it. And additionally, those assessments we do, especially one particular one, it's called the burden scale for family caregivers. It really hones in on that, and it starts to kind of ask about some of those things. And that tool sometimes has somebody self-identify. They'll sometimes, based on those questions, they'll kind of say, oh gosh, I am providing care, or I didn't realize the impact this was having in my life.
That's so interesting. So this assessment specifically works to identify burden that a caregiver may be experiencing, or
yes,
something. Okay.
And of course, we hate that word burden, but that's the name of the scale. So
sure.
There it is.
Yeah.
But really, it's just what's the impact, right? Because nobody wants to think that their loved one is placing a burden on them.
Of course not.
But it's really just honing in on just what impact it has and how we can support and how we can minimize any kind of strain that it may have, because it is an additional task, and some of those tasks are quite intense. Some of them are very medical in nature, and most of us aren't trained in those areas and may not have been ready, willing, or able to provide the care that we are now expected to be providing.
That makes perfect sense. And one of the things that we're expanding into with the age-friendly work that we're doing now is having a little bit more of a focus on health equity and making sure that we're understanding the individual and their background and the different cultures and the language and how all of that plays into how one might one might make their care preferences. How do you account for that in the caregiver program?
That's so important. And so, as I mentioned earlier, we really look at each individual caregiver. That caregiver comes to us or is referred to us, and we're really spending the time to get to know them. In fact, we don't even call it assessment when we work with them. We call it a getting to know you meeting,
I love that.
because really that's what we're doing. First of all, we want to make sure that they're heard, because caregivers often go unheard. So we want to know from their perspective what's happening for them, what kind of care they're providing, just what their situation is. Sometimes they're living with the person they're caring for. Sometimes they're long distance. Sometimes they're an hour, whatever it is. We have that conversation with them. So
Sure.
as we listen to them and have that conversation, first of all, we're reflecting back what we hear. So we're making sure they're heard and understood.
Hmm.
And then we do start asking those series of questions that kind of gets a little bit more information,
Hmm.
identifying their needs, but also what are their preferences?
Right.
What are their, culturally,
Hmm.
sometimes culturally they don't have, quote unquote, a choice in providing the care. It's just part of what they do culturally. That's not going to change. It can also be part of the culture not to have any additional support come in as far as like a paid caregiver or outside help. It's within the family. So those are the aspects that we take in and consider and just support that caregiver in developing a plan that works within their beliefs, their values, their culture, etc.
That is amazing to hear that you are working to ensure that all cultures are accounted for, and preferences are accounted for as well. Could you share a story perhaps about a time when you were able to account for an individual's and a family's cultural preferences?
Sure, that's a good question. So there's so many different circumstances. I mean, my mind is swimming right now, but I do have one that I can share with you, that I think we've seen several times, where for this particular person's cultural viewpoint, as the oldest daughter in this particular family, it was her role. I mean, that's just the culture is the oldest daughter is responsible for the care of the parents as they get older and as they need. So that was kind of her designated role. It was culturally part of what she was charged with doing, but she was overwhelmed by it. And she was her mom was caring for her mom at the time, who was diagnosed with dementia, and she was also working at the time. And so what we did and what we worked with her on is, because she couldn't change the role and it was not an option to bring in additional help, so to speak, it was really kind of shoring up her resources, her coping skills, and also really helping her to understand the disease that her mom had. Really giving her some education on dementia, and also really some practical tips and resources for managing some of those behaviors and some of the aspects. That maybe the repetition and asking something. How do you manage that? Some redirecting if somebody is asking over and over. Just different tips that she had not known before, that really then gave her almost like a toolkit to be able to use as she proceeded in her role. And it did reduce her burden and some of the anxiety that she was feeling about her role.
That's amazing to hear how you were able to provide benefit to that caregiver within those certain parameters. So that's amazing, and thank you so much for sharing that. Can you tell us a little bit? I understand that the program is going national, and that folks are able to join at no cost to them. Can you tell us a little bit about if an organization is interested in bringing this type of program to their organization? How would one go about doing that?
Oh, I'd love to share about that. So, as I mentioned, the program was originally funded by our Foundation for Aging for the creation of it, and continued to support us over the years. And then the John A. Hartford Foundation provided funding for us to pilot test the model in 6 age-friendly health systems to really just see, kind of look at, is it implementable in all settings or in a variety of settings? Looking at maybe scaling and spreading it across the country. So we did do that pilot testing. It was very successful, and we did implement in a variety of settings. We did a dialysis center, we did a geriatric primary care setting, we did a caregiver resource center, et cetera, an ACE unit, which is an acute elders care unit. So we really got, an understanding of how this could be implemented in just various ways in different settings. And so based on that success, we were refunded by the John A. Hartford Foundation to then share this model with other age-friendly health systems and area agencies on aging across the country. So really, they can just contact myself or look at our website, Caring for Caregivers Across the U.S., and get in contact. And we are happy to just have a kind of a chat, a meeting, to kind of explain the program. And then what we do is really work with that particular health system to see how is it going to be adaptable for their setting, because not all settings have the same resources available. So we really work with that setting to kind of develop that plan. We do a full training and then offer technical support.
And I just want to get a little bit of clarification, because I think I heard us talk about how you are testing it in a dialysis center and different, and like the ACE unit, which all are, clinical sites. Did I hear about a caregiver resource center? And is that something that's a little bit non-clinical? And maybe you can expand on that for some of our listeners who might not be as familiar.
So one of the sites that pilot tested for us was Northwell Health. And one of their settings was they have several caregiver resource centers within their health system. And so we tested that model there. It's not a clinical setting. It's not a medical setting, although it's within a medical setting. But it is a clinical setting because it's like our program at Rush. It's got licensed clinical social workers that are providing supporting caregivers. So what they were doing was a little bit more like care management for their caregivers and connecting them to resources. But what they weren't doing was what we do, is going into those individualized sessions for caregivers.
Okay.
So that's what they brought into their resource center. So they kind of enhanced what they were already providing.
And that's perfect. So it looks like there's a few different ways to get involved, a few different types of sites that can reach out to you if they chose to be involved.
Absolutely.
And I think we're just right on time. So just any last comments or anything that you wanted to share to our listeners today?
I think our goal is we just want caregivers to be supported, because when you support those caregivers, the care recipient's going to do better. And we have outcomes to show that too. We're seeing reductions in ED visits, lengths of stay, and times that older adults are coming into the hospital, which is really important for them and for health systems at large. And one last thing I'd like to add is how can caregivers really get this information or get involved or get connected? So for caregivers that are in Illinois, they can reach directly out to Rush University Medical Center at the Caring for Caregivers program, and we can support them. For those that are outside of Illinois, certainly watch for your healthcare system to be implementing the Caring for Caregivers program. But in the meantime, as we're sharing this model, I would suggest reaching out to your area agency on aging, because most of them, if not all of them, do have caregiver supports and can connect you to important resources.
That sounds fantastic. Thank you so much for your time today.